Good morning, everyone. Thanks for joining. We've got a good crew rolling in.
Good, Ryan.
Michelle, thank you for being here. It's good to see you.
It's good to see you too. How are you doing, Ashley?
Great. Michelle, do you mind if I record this?
Oh yeah, please go ahead.
Okay,
No
great.
problem. So everything was approved, so feel free to record and share. And I know I sent over the slides, so that can also be shared with everyone.
Perfect. Thank you so much.
Of course.
Michelle, I'm happy to watch the lobby and admit people. If we want to get started, I can kick you off with a brief introduction if that's
Yeah.
helpful.
That's
Okay.
perfect. I was just waiting. I was like, whenever you, tell me to go, I'll be ready to go.
Perfect. Well, I don't have a formal introduction team, and I appreciate everyone being here, but I'll just speak from the heart, which is easy to do because we're big fans of Michelle and the STAR 2 Center at KPCA. So the STAR 2 Center is within the Association of Clinicians for the Underserved, and the STAR 2 Center is an NTAP, so that's a National Training and Technical Assistance Partner. There's several NTAPs that partner or provide technical assistance in different areas. So the STAR 2 Center does workforce development, and we work with them frequently. They're a fantastic team. We had Suzanne Spear, if you were able to join us at the conference, speaking about considerations for different generations in the workplace. And Michelle today is going to provide a great overview of kind of the health center movement and really the true value that each of your roles have within your organization. Michelle is a social worker by training, and I've been to many trainings by Michelle, and she brings a really wonderful, people first perspective on how we can treat our workforce to just make sure that we all are thriving in our workplaces. So I'll turn it over to you, Michelle. Thanks again.
Thank you. That was like the nicest introduction. So, and Ashley,
I
you
mean
all
it.
thank you. All of you all at KPCA, we love partnering with you. You all are amazing. So if everyone can just give me a second, I just want to share my screen. We usually use Zoom. So just trying to figure out, I think if I just share the whole screen. Oh, you all are seeing my chaotic background. Um, that works for me, I promise. Like, give me 1 second. Let me just put all this. Oops, sorry, everybody. Okay. Can everyone see right now? I know it's not in presentation mode yet. Now you can see it. Okay, perfect. And then I may have to, I'm trying to figure out how to switch back and forth because I have another one where I need to share the Mentimeter. Ashley, do you know how I can, let me see. Sorry, everyone, the technical. If not, what I'll do is I'll stop sharing and then just reshare so it goes to the other screen. So that is not a problem at all. But welcome, everyone. So excited to be here. As Ashley said, we've partnered a lot with the Kentucky PCA, really one of our favorite PCAs to work with. And Ashley is absolutely wonderful. But yeah, today we're going to go in and we're going to talk about Health Centers 101, really understanding how that connection comes to the work that you're doing. And then we're also going to go a little bit into just concepts of professionalism, because one thing you'll hear me say throughout the presentation is you're really standing on, the shoulders of giants. Like the health center movement, where all of this came from, is so, so powerful. And then I want to talk about communication. So how do you really support each other in the workplace? What I had mentioned with Mentimeter, I actually set up a bunch of Mentimeter questions, and I did that on purpose because I would also really like this to be interactive. So we may not get to all of the questions. The other thing I want to say is if for some reason, and I'll explain how to use Mentimeter, if you don't know, if for some reason it doesn't work or anything like that for you, you can also unmute yourself. You can put the answers in the chat. We use Mentimeter because it's completely anonymous. So nobody would be able to see like who responded to what. So some people just really like having that anonymity. Sorry, it's early and just trying to pronounce some of the words. Okay, so let's go ahead and get started. Just going to do a few intro slides. So as Ashley said, we're here with the Association of Clinicians for the Underserved, or ACU, and we were started a little bit over 25 years ago by National Health Service Corps alumni. So it's still very much of the foundation of what we do, but we have a lot of different types of programming, especially centered around the idea of workforce and how to really support the workforce in community health centers. And the program actually that brings me here today, as Ashley had said, is the STAR Center. So we are one of 22 national training and technical assistant partners. And really what that means is everything that we create, so our resources, our training, our technical assistance within specifically the STAR Center program is all free for you to use and for health centers. That's what we're here. We're here to support the recruitment and retention and workforce at health centers. And then we are funded by the Bureau of Primary Health Care and the Health Resources Services Administration. And the STAR Center stands for Solutions Training and Assistance for Recruitment and Retention. I do also want to point out on this slide, so we do have our own website separate from the main ACU website. And the reason for that is, as I said, everything we offer is free. So we're hoping just to make it much easier for you to go on there, access everything you need. And then you have our email, which is at info@chcworkforce.org. That does go to a real person. Actually, I think my colleague, Sydney Axelrod, is on the call, and any inquiries go to her. So this is the wonderful STAR Center team. As I mentioned, my colleague Sydney Axelrod, who's the Associate Director of Workforce Development. We also have Mariah Blake, Associate Director of Workforce Operations and Compliance. I am Michelle Fernandez Gabilondo. As Ashley said, my background is in social work, so I really try to bring in that perspective in any of these trainings that I do. And then we have our VP of Workforce Development, which is Suzanne Spear, who recently presented over at the Kentucky PCA conference. All right, so as I mentioned, I have several different Mentimeters through here. And the thought process, again, was really just get you thinking, like, how does this work in your health center? How are you connected to the work that your health center is doing? So you can go to menti.com and it's going to ask you for a code, and the code is right up here. If you have your phone and that's easier, you can also just put it up to the QR code. And I'm going to leave this up just for a moment. And what I would suggest is, as we go through the presentation, don't close that window, the Mentimeter window, because the new questions will pop up and you'll be able to put in your answers. So it's just going to be a lot easier if you leave it open. So in a moment, I'm really going to go deeper into, what do health centers do? Like, what does it mean to work at a health center, and what is the impact that all of you are making? And I really want to emphasize every single one of you, regardless of the position, that, oh, and I do hear someone, I don't think it was a question. Yeah. One thing is, if please feel free to mute yourself if you have anything to add. If you're not, if you could mute yourself, that would be wonderful. So I really appreciate it. Okay. So as I was saying, this is really thinking about, regardless of the position that you're in at your health center, you play a pivotal role in supporting the patients, in supporting your community. So this is the first question. Just in a few words, I just want you to describe how your health center is serving the patient population and the community as well. And it's really important to understand that, because again, it's connecting you to the work that you're doing and what are those outcomes that you're seeing with the patients that you are serving. So let me go ahead. I think the only way that I can kind of toggle back and forth, oh, maybe this may work. Okay, perfect. That was easier than stopping to share. Okay, and everybody's already putting in, so no one is turned away. Outreach, non-judgmental care. I really love that, the non-judgmental care. I think that's the first time I've seen someone say, an answer like that. And that is so, so critical. We know that there are a lot of barriers to care, and being able to really, again, bring in anyone who needs care, doing it in a non-judgmental way is so, so critical, because all of us, have probably been to the doctors at some point where you're kind of like, I don't know if this is the right fit for me and stuff like that. So all of you, what you're doing is so critically, critically important. And I see, so basically what happens, this is a word cloud. So as people, the more answers that people give, it's going to pop up bigger. So I see serving the underserved as really the main one, and absolutely definitely agree with that. Family oriented, access, compassionate care, serving with compassion. And exactly, that's another thing that all of you bring. And I think a lot of times when we talk about serving the patient population, we think more of the providers or the allied health individuals, but people who are working at the front desk, you're the first face that people see when they come into the health center. Anybody maybe even working in maintenance, like you're cleaning the rooms to ensure infection control. So if you're working in IT, you're making sure that everything is running and people have what they need. In administration, in HR, you're ensuring that the health center has the workforce that it needs, because without a workforce, you don't have a health center. So I know I didn't name everybody who works in a health center, but I just really want to emphasize that piece, that all of you are really playing a critical role to ensure that you're doing exactly what you're writing on here. So I'm going to ask one more question before we really dive into the presentation. And the next one is, just what part of your job connects you the most to your health center's mission? And this one, it's not a word cloud. It's just like open-ended responses. So I'm going to give everyone a moment to think that through. and we'll see what pops up. And again, if anybody prefers to unmute themselves, to put anything in the chat, please go ahead and do that. And Ashley, I'm just going to ask because I'm not sure if I can see the chat. So if anything pops up, if you could just let me know, perfect. Going out into the community and providing access to care to all populations, exactly. And doing that is such a unique thing. That is not something that happens in every type of clinic and hospitals, and we know this. You all are doing a very, very unique thing of ensuring that those who are underserved are getting the care that they need. So another one, creating career opportunities for community members and patients. This is really important because we know at health centers, a lot of the people who are employed there are coming from the community. So not only are you seeing that connection with the patients, but you yourself, some of you may be from those communities. So you're coming back to serve your community and to really support them. I like the person who wrote everything. So that's great. Like that's exactly, you really want to feel that. Being able to serve and meet patients where they are, no matter the circumstance, exactly. I am a huge proponent of meeting people where they are. It really is kind of a principle of social work. One thing that they always taught me when I was doing this, it's like, it's not about you, it's about your client or your patient. And I think that really goes into this piece of, serving the patients where they are, because everybody's in a different place when it comes to their healthcare and a lot of the complexities that come along with that. The direct connection I build with patients and family, being able to meet people where they are physically, emotionally, spiritually, allows me to live out the mission. Absolutely. Being available for every patient's needs, regardless of barriers to care. Exactly. And I feel that in an HR role, I can pour into the employees, giving them more tools to better serve patients. Absolutely. And I'm so glad that this was written in here regarding, the individual who is in HR, because one of the things that you're going to hear me say as well is all of you as health centers, you have an amazing mission. You're doing amazing work externally with your community, with your patients, but it's really, really important as well for that mission to be reflected internally in how your staff is being treated, how the staff is being supported. So that's part of what we're going to be talking in today's presentation, of just not the external, but also the internal. Like, what does that mean for the dynamics in the organization? What does that mean for how you work with patients, how you work with each other? And really just, it comes down to that empathy and respect that all of you really have for each other, working for the same mission, and then the same for the patients that you serve. So thank you, everyone. And then I see, I see there was one more, providing medical care as a physician who is himself from a minority community. Absolutely. That is very, very powerful. So just kind of, I guess, learning a little bit about me, if you all couldn't tell from from my last name. I am Latina, and I know for me, I just actually moved back to Florida where I grew up, and being able to just support your own communities that you grew up in. And, for people who, you may not have thought, oh, this is what I'm going to achieve, and you're there and you know that you can give so much back. And I'm speaking from my own personal experience. I don't think I ever thought, I'm like, oh yeah, I'm going to get my doctorate and then I'm going to be able to go back and serve. So just having that from your own background and being able to give back is incredibly powerful. So thank you so much for all of the responses. So let's go back to the presentation and really dive in to everything. So I do also want to say, I, love when people have comments throughout, like add anything you want, challenge me. It doesn't matter. I have a very flexible type of way of presenting, and I really like, as much as we can, to have a dialogue. So I'm going to start with just baseline, why health centers? Why does this matter? And we have so many people that work in health centers, and you go in, you're attracted to the mission and really serving your communities. But I think sometimes we don't always realize the level of impact that we have with all health centers together. So I just wanted to pull this information. This came from HRSA, and I believe that they recently released these statistics. So as you know, anything with data and stuff is always about a year behind, because right now they're collecting the 2025 data. But the work that you're doing is directly impacting these results. And again, doesn't matter the role that you play, you are making a difference with this. So, as it says here, in 2024, more than 32.4 million people received care at health centers, so the HRSA funded health centers. So just to make it easier, I will kind of interchange. I'll say health centers or community health centers, but this is one of the largest numbers of people that receive care. Normally it is over a little bit over 30 million, but we're looking at 32.4 million. Not only does that indicate the level of need that there is, but just how much work all of you are pouring into your communities. So what did this include in these 32.4 million people? 1 in 8 children. We know children, when it comes to pediatric care, there are a lot of barriers. And then we look at workforce issues of not being, not having enough providers and things like that. So health centers really filling those gaps is so incredibly important. So serving 1 in 8 children, and this is across the United States. So that's huge. 25.1 million people were either uninsured, on Medicaid, or Medicare patients. So again, we're going back, especially when you're looking at like uninsured individuals, to serving those who are underserved. 1 in 5 rural residents. Again, we know that rural areas have a lot of barriers to care simply because of distance and just a multitude of different things, including the fact that even recruiting a workforce into these areas can be very, very complex. And I'm sure any of you who are located in rural areas definitely know this. So the fact that you are doing so much, even with the limited resources, and you're still serving 1 in 5 rural residents, that is so critical, because this is the place that they can go to get the care that they need. 1 in 15 patients are 65 and older. We have, a very large aging population that has a lot of medical needs. All of you are stepping in to support that. And then 408,000. I'm so sorry. I'm so bad at saying numbers. Actually, my first language is Spanish, so every time I read numbers, I just want to say them in Spanish. So I apologize for that. But the amount of numbers of veterans that you are helping, and this is really, really critical. Again, I feel like I'm going to put little pieces of myself in this presentation, but I come from a military family. My dad is a Vietnam veteran, and there's such a need for care from veterans, and we know that they have the VA system, but there are a lot of gaps there as well, and you all are really filling that gap. So I really just wanted to highlight this to say, this is what we're seeing nationally, and not just across the United States, but it also includes all US territories. So these are really huge, huge numbers that you all are supporting. And then when we look, about 90% of the patients are at or below 200% of the federal poverty level. So again, it goes back to being able to give access to those who are facing many, many barriers to care. Okay, and then what does this impact mean? Again, like I said, I just want to start off giving you numbers, because I think sometimes we also just, you move forward with your day, you start your day, you finish your week, you kind of don't always realize the level of impact that you're making. And working in healthcare, working at health centers can be very exhausting. We know that the workforce struggles with burnout and a lot of other issues. So I truly believe sometimes just being able to see the impact that you are making can help you say, okay, what we're doing is really worth it. And this is something that is truly helping so many individuals across the nation and all US territories. So I'm not going to go through and read all of this, but health centers really, again, you're that primary care provider. So you play a key role in chronic disease prevention and management, everything when we're looking at hypertension, diabetes. You also really offer the pediatric patients weight assessment, nutrition, counseling. So these are all really critical for the whole person health care. You're also doing a lot of preventive screening. So again, you are primary care providers, and that's exactly what you're doing. So we're looking at screenings for breast cancer, cervical cancer, colorectal cancer, and we know the earlier that you can screen and catch things, the better potential that you have for more positive outcomes. So you're literally saving lives. And I really, really want to emphasize that, because as we go through the presentation and we talk about why is it so important to have certain aspects of really strong communication in their health center? Why is it so important to ensure certain aspects of professionalism and things like that? And it's because you are serving in these front lines to really help people in a way that is saving their lives. So what you're doing, and again, regardless of the role that you play in the health center, is so critically important to millions and millions of people. Another one that is really critically important and often very overlooked, you are doing so much for the mental health of patients. So obviously, with me being a social worker, mental health is my background. And I think for a long time, and even still in many ways, there's a lot of stigma around mental health. Coming from a Latino community, that was something that was never really talked about. And I feel like health centers, you all are able to open that door for people. You're able, when people come in for primary care, to give referrals, to do depression screenings. And again, this creates just a fundamental difference, a good, healthy, positive difference in people's lives. And then finally, and this is huge. This is really great. So the most recent health center patient survey said 97% of patients would recommend their health centers to family or friends. I haven't really seen that percentage when we look outside of health centers, like, private networks, hospital networks, and please know some of them are absolutely amazing, but just the cohesiveness and the work that you're doing is showing how much patients not only need you, but also really appreciate the work that you do. And I know that it's difficult and at times it's incredibly hard. And you may have days where it's just like, why am I doing this? I am so tired. I just feel so burnt out. But in general, overall, you really have so much appreciation from people just across the nation, across US territories, because you're providing them with something that they wouldn't be able to get somewhere else. And, we need healthcare. We need to make sure that we are okay. And that's exactly what you are all doing. And then just to kind of wrap up this section, like I said, I really just wanted to form a baseline of like, what are you doing? Why does this matter? I also wanted to give a little bit of the history of health centers. So I'm not sure how aware everybody is around the health center history. I know everyone, you kind of have a different understanding. Some people are also newer to the health center world. So this may be something that they just have not heard before. So when I say that mission connection and why I ask that question in the beginning is because you're a living legacy of this history. You're continuing this history that is so fundamentally important. There is a documentary that's called Out in the Rural. You can find it for free online, and it specifically goes through Dr. Geiger and Dr. Gibson on why they started the health center program. What does that mean for them? And you look at the history behind this. But when we look at health centers, it really started from ensuring that people were given access to healthcare, those who normally did not have access to it. And it was started by Dr. Geiger and Dr. Gibson. So really they pioneered the health center program. They were very similar programs prior to that, but they were the ones who really got everything going and really solidified what we know today as these federally qualified health centers. And the first two health centers were founded. One was in Massachusetts, the other one in Mississippi. Again, it was really looking at these communities and the need that was there, and having Dr. Geiger and Dr. Gibson stand in and say, well, we could do this differently. We could do this in a way where no one's going to get turned away, where we are going to be able to provide care for everyone, regardless of, ability to pay, barriers, things like that. And then currently right now, there's approximately, I believe, a little bit over 1,400 health centers, and you have about 16,000 sites nationwide and US territories. And when we think about that and the numbers that you're serving, it really shows just how much demand and need there is for you. So these last two bullet points, I'm not saying anything that you don't already know, but your purpose is really providing that primary care that is high quality, that is comprehensive, that is affordable. And again, this is really a lifeline for so many people in this country that may not have access otherwise. And then, as I had said, really, there's such a rich history of mission-driven work. And I really would highly, highly recommend just look up the history, like really understand, what does it mean to come in and work at a health center? What does it mean to continue this movement, to really, again, stand on the shoulders of giants and be the leaders for the future of the health center movement and the health center program? And all of you have the ability to do that. And honestly, you are already doing it simply by the work that you're providing. Okay, so like I said, I just wanted to start with some statistics, get everyone a little bit of a background of, what is the impact that you're making. Now, we're going to shift a little bit on mission connection, because it's really, really important for anybody who comes to work at any type of community health center that you feel a connection to your mission. And as I said, this is not just solely reflected externally, but it's also reflected internally in the way that your workforce is being supported, how, we treat our fellow coworkers, how we do the team-based care. Like, these are all values and principles that we really should lead with when working at health centers. Now, as I say all this, I also want to acknowledge there are going to be hard days. There's going to be hard weeks, hard months. Like, things are not easy. It is, sometimes a daily struggle. But if you're able to keep that connection to the mission, that really helps further fuel your drive in, why am I doing this? Like, why am I here? Why does this matter to me? And you really should ask yourself that question personally as well, looking at, how am I connected to this work? And then we can look at the larger organizational structures, the larger potential for organizational change to support the workforce, things like that. But at baseline, really just saying, what does this mean for me? One thing, since obviously we do workforce recruitment and retention at the STAR Center, we have some trainings that are, best are promising practices when it comes to interviewing. And one question that we tend to recommend for organizations to ask is exactly that for the candidates. Like, how do you feel connected to the mission, or how do you understand the mission of the work that you're doing? But mission is just kind of a word, I think, sometimes that we use a lot in nonprofits, but what does it really, really mean? So this is another, and I have to go and just move the slide in a moment. But I do want to know, do you know your health center's mission? And the reason that I'm asking this question is because sometimes we don't. Sometimes, we're not even sure where to find that. So I always recommend for people who are in leadership positions, ensuring that you have this front and center on your website, that it's something, when you have team meetings every once in a while discussed, so people really understand that connection. So let me go back to the Mentimeter, and this could be a very, simple yes or no answer. And I put maybe on there because some people may be like, I may know the mission, but I'm not really sure. So what I'm seeing is most people are saying yes, which is really amazing. I have asked this question in other presentations, and I will say I've never had only yeses. So this is awesome. You all are doing great in Kentucky. So yeah, it seems like most people really know their health center's mission. So now what we're going to look at is, how are you connected to? How are you working within that mission? And how do you fully understand what that really means? So yeah, I'm really excited for this slide. This is so great that everybody is saying yes. Never seen that before, so I will take it. Okay. So, and one thing that I'll say as I go through this presentation, we'll talk about different terminology. So here we're kind of defining what's the difference between a mission and a vision. But at the end of the day, the actual words are not as important as what you're doing with that. Like, what does it mean and how does it impact the work that you're doing? But every nonprofit has to have a mission. So all of you are in organizations that have missions, and it's kind of nice sometimes just to sort of get an idea of, how do these different things really, what do they mean and how do they differ from each other? So mission is really just speaking to, why does your health center exist? So this is where, and missions and visions both should be pretty short. I know some people like to have much longer ones, but it really is kind of like a quick way to understand, why are we here? So a lot of missions may include the population that you're serving, especially health centers that may be serving specific populations. Some health centers have broader populations they serve, but again, asking yourself that question and being able to answer it. So it also goes back to why I was saying, look at the history, not just the history of the health center program, but I think it's really, really helpful to also see the history of your specific health center, of where you are working. Most health centers, have really rich histories, have amazing stories. You see the populations that you have helped. So again, you're connecting back to answering that question, why do we exist? Why are we here? And then the vision is just really, what do we want for the future? Now, not every organization has a vision, but the reason that I wanted to put this in here is, not only are you connected to really meeting the mission of your health center, but this has been, the health center program has been around for quite some time. So there's so much more that is left to do. So the vision is really looking at that. Like, what do you want the future to look like? All of you right now are in a position where you're really shaping that future of US healthcare, access to healthcare. I mean, that is huge. Again, if we go back to those numbers, the amount of lives that you're saving through the primary care that you're providing is so, so critical. So you all are not just playing a role in your organization, but you are really looking towards, what is that future and what is that inspiration that we're trying to achieve? Now, your organization will have, specific language on this, but I also recommend that you have your own on that. Like, what does this actually mean to you? Because the more connected that we are to the work that we're doing, really, it increases our engagement, it increases just the satisfaction that we have. And one thing you'll hear me say again and again, is that perfect? No. But there is still a lot to be said of being able to go to work and be like, I'm making a difference. I'm doing something really, really positive. And that can be a huge driver for many, many people. Now, does that negate, all of the other aspects of ensuring that people are being supported in the workplace, fair compensation, staff well-being, all of that? No, but it does help you drive towards, why am I here and what does this mean for me? And as a matter of fact, the better understanding that you have of that, the more that you can play a role in your organization to really support those aspects of well-being, support your coworkers, support organizational change. So the more connected you are, really, the more engaged you tend to be across the organization, not just in the services you're providing, but how are you really engaging in the actual organizational norms and values? I also like this slide. So this slide was created a little while back by one of the former Star Center members, one of our former associate directors. And this slide, more than anything, I really want to highlight this for individuals who are in those leadership positions. Because as I said, ensuring that your staff really understand the mission, ensuring that your staff feel a connection to the work that they're doing, and that they know that the amazing work you're doing is not only external, but also internal in the way that the workforce is being supported, can have really positive outcomes for the health center overall. So I know, millennials, I feel like we're now mainly like in our late 30s and 40s. So really trying to look at, what does this mean also for the younger generations, people who are coming into the workforce? But a lot of that data is still being collected. So just wanted to put on here, when we're looking at, people coming into the workforce, that mission connection and having a purpose and how you really feel that the job is important is critically important. So we're looking here at about 67% of millennials really are engaged in work when they're able to connect to the mission. And I don't think by any means this is specific to millennials. This is across all generations, but it was more of being able to pull a statistic. And I would also venture to say that when we look at the newer people coming into the workforce, this is an estimate, but we may see higher numbers to that mission connection. I think people just really want to do work that has meaning for them. And, even when you're looking for jobs, I know for me, one of the main things is like, okay, what is the mission for this organization? Like, most people, I don't think, are necessarily going to seek out employment in mission-driven organizations if they're not somehow connected to it. So what does that mean? It helps with performance gains. It helps to increase employee loyalty and retention. That is so important. And retention is critical across the board. So not only for the organization to make sure you're functioning, as I said, if you don't have a workforce, you don't have a health center, but also for the people who are employed there. That retention is so critically important because all of you are working as a team. And when someone is missing from that team, it's really difficult. Other people really have to go and potentially fill in those gaps. It can just get very, very complicated. So the more and more that we can connect to that and people feel engaged, that they feel really that loyalty to the work that they're doing. And I also want to say, when I say loyalty, it shouldn't be just like blind loyalty. The goal of everybody who is working in an organization is really to contribute to change, to move towards a very positive type of work environment, but retention impacts everyone. So it's really, really important to keep that in mind. And this is one of those places where we recommend to people who are in leadership positions, and it doesn't have to be just the C-suite. I'm talking about direct supervisors, things like that, of just every so often bringing back the mission, talking to your staff of like, how are you connected to this? How do you feel that you're really contributing? You know, how do you feel about the work that you're doing? And those conversations are also really, really critical because you get so much information on, okay, what does our staff really need to thrive? What does our staff really need to be engaged? And as people in leadership positions, you can then make those adjustments based on what you're hearing. Also, more mission-driven organizations tend to have better customer engagement. I think health centers, you all do a really, really great job of this, not just because you understand the important work that you're doing, but also because so many people who work there are coming from these communities. So, you know, you feel really proud. You're like, I'm going back and I'm serving my people, and I want to ensure that I'm offering them the best customer service, that they really are engaged, that they're able to get the best services possible. Mission-driven workers also tend to have improved strategic alignment. Again, I think it makes sense if you're really engaged in the work that you're doing when, you know, leadership is really strategizing, doing their strategic planning, all of those things, people can really be involved in that and help shape it to, again, make the organization the best it can possibly be. And then it also has enhanced clarity about the work priorities, because that mission should really be that lead into what are we prioritizing as an organization. And I'm going to go back for a moment. You know, that question of why does your health center exist is really that stepping stone for that piece. What are our priorities? Who do we want to serve? How do we want to serve them? And how, as a workforce, are we able to provide our individuals that are coming through our doors that, and then also provide that cohesiveness, that just everything to our fellow coworkers? And we'll get a little bit deeper into what does that mean in the piece when we talk about professionalism and how you really are engaging in the workplace and supporting your fellow coworkers and also the patients that are coming through your doors. Now, I really like this slide, and the reason that I wanted to point this out is because I think it is so important when we look at the impact of health centers, when we look at the history of the health center program, it really is because there's so many people that stood up and said, okay, there's something right now that needs fixing, and we're going to fix it. And we're going to work to make it better. And that really comes from the fact that so many of you who are stepping into health centers, who have positions in health centers, are really leaders. Like, you're seeking out employment in a place that in many ways really requires you to be that. And one thing I like to say is just because you're in a leadership position, I think all of us have had this at one point or another where we're like, you know, you may have the fancy title and all of that, but does that really make you a leader? And for so many people, I think in health centers, yes, that is definitely the case. But we also have people that sometimes are a little bit more disengaged or a little bit more hesitant on, you know, how do you support the workforce? How do we support our patients? So for all of you, and really kind of almost like a challenge that I'm giving you, is really understand your role as a leader. It doesn't mean that you have to be in a leadership position, but being able to be a leader is really, really critical. And I think it also holds you to a very high standard in your workplace that really will impact everyone around you. So what does that really mean? What is leadership? Again, this is where, when we think about people in leadership positions, but here we're talking more about the traits that you're bringing. So being visionary, driving innovation, guiding change, aligning, influencing, emotional intelligence is so, so, so critical. And this is something that everyone should have. We talk a lot about the hard skills of making sure that, you can do the critical things of your job. But when we're looking at emotional intelligence, this is where we're looking at soft skills. This is where we're looking, how do we communicate with each other? How do we bring empathy into the workplace? And everybody could do that. And honestly, everybody should be doing that. And these are skills like anything else. There's not, you're not like just magically born with this, and how to proceed, how to be empathetic, how to have emotional intelligence. It's something that you do need to work on. But the key here is and again, bringing in my like social work background, is when you're working at community health centers, the way that you interact with your fellow coworkers, the way that you interact with your patients, the way that you interact with people in leadership, and vice versa, like really that multi-directional, should really be led by empathy, because this is a hard job. It really is a hard job that all of you are doing. So how can we really come together as a team and support each other? So something as simple, and I'll talk about this in another slide, just ensuring, like, for example, being on time. That, especially in healthcare, can have a really big impact on just the whole dynamic of the team. And I'm the first to call myself out, and you all will see this throughout the presentation. I have always struggled with that. That's just, it has been something, but it's something that I work on really, really hard. And I especially learned this when I worked at an emergency room when I was living in Washington, D.C. And I remember one of the physicians there, he would always say, he's like, if you're on time, you're late. If you're 15 minutes early, you're on time. And I was like, what does that even mean? Because I'm like, if I'm here on time, I'm good. Now, that's not to say everybody has to do that, but I think it fundamentally goes back to this simply respecting the workplace, respecting your fellow coworkers, because I understood if I wasn't there on time, then everything was really delayed. And I think that's an aspect of emotional intelligence. It's an aspect of empathy, of respect. Again, that's just what in the workplace we want to ensure that we can support each other. Now, is that going to happen 100% of the time? No. I lived in DC where sometimes, the metro would catch fire. And that's the truth. And then I would have to call in and be like, I will be there as soon as possible, but literally the red line right now, I'm getting a notice that it is on fire. So, that empathy, I think, also extends into that place. But at the end of the day, it's like, how are you respecting the workplace, your fellow coworkers, all of that? And that shows that you are a person who really is a leader. So also taking risks, fostering ideas. I wanted to put this kind of flip to this graphic that we put together of, because sometimes we also kind of put leadership as management, as both of them being the same, and they're not. As you can see, leadership really is those higher aspects, the idea of what does it mean to be visionary? What does it mean to collaborate, work with your coworkers? Management, those are the people who are in those direct supervisor positions or, higher up directors, C-suite, things like that. They're the ones who are implementing the processes, executing those organizational goals, very task focused, focus on the systems, the structures, coordinating the actions, minimizing risk. But they cannot do that without everybody working together as a team. So, people who are in those management roles, it's really critically important that you understand those concepts of empathy, that you understand those concepts of how are you supporting your workforce, because it can't just be on one side either. This When I say a full collaboration, it is a full collaboration with everyone who is working at the health center. Because at the end of the day, your ability to collaborate and be cohesive, not perfect, but collaborate and be cohesive ensures that you can continue to provide that best patient care. You can continue to provide what you need for your community. And again, essentially, it just goes back to connecting, meeting the mission of what you're hoping to do. Now, there is also a lot of overlap around management and leadership. So, this is where motivating staff, executing the mission, again, going back to that same idea of how are we doing this, explaining the vision. Sometimes we don't know, we don't actually, not sometimes, none of us know what the future holds, but the more that you can really be prepared for it, you can try to understand what your goals are and what you want to achieve. It really helps you better explain the vision of not only what you're doing, but also of your health center. And then, when you merge that management with the leadership, it should really be about bringing out the best in staff. And we're going to get a lot into communication, but it is so important to have multi-directional communication. Communication should not solely be in one direction. So not completely top down. Oftentimes that's what we see, but sometimes we see it in the reverse where people, it's like, I need to manage up. And that doesn't really help anyone in the structure of the organization, in the structure of how you're working, in the idea of being able to retain people. So again, it's like, how do you work cohesively to really bring out the best in everyone? And a big part of that is when everyone is able to contribute, to be able to facilitate change in the organization, to be able to speak up and say, hey, I have an idea for a different process. What about trying this? Now, that doesn't mean that what everybody says and every suggestion is going to be put into a reality, but it's really important, especially for individuals in leadership, to simply listen to that. And it is also okay to say, at this time, that's not something we're able to do, but people know that you're listening to them. So that's why that multi-directional communication when it comes to this is so critically important. Even the example I just gave about being on time, if I don't communicate to people like, hey, the metro is on fire, people are just like, where is she? Why is she not here? So those, at a very granular level, it's just so critically important. And it really shows the leadership skills that you have and just the respect overall for your coworkers, for the organization, and your patients and your community. Okay, I really like this slide. I created it a while back. It's really simple, but what does it mean, again, to be that leader? And I really want you to think of yourself, whether or not you are in a more official leadership position, as a leader. I think all of us have been in an organization, or at least a lot of the places that I worked before. I always remember there was always somebody who worked at the front desk, and it was someone who had been there for like 30 years, and they know everyone, everything, and everyone really follows what they're saying. And in many ways, when we look at the organization, they almost had more power than the people in the C-suite. And simply from the historical knowledge they have, how long they have been there, everything that they've seen with the organization change. But I also feel like one of the things that they really exhibit really well, and when we see people who are in those positions where other people are looking up to them, other people are asking them questions, or simply wanting to engage with them, hearing the history of what was it like being here for as long as you've been here, how have things changed, they tend to have these three qualities, which are empathy, humility, and vulnerability. And for all of you, as you approach your job, it's really important to have these 3 skills. And like everything else, these are skills that you learn. These are skills that you practice. It's not like, some people have this a little bit more naturally than others, but it doesn't mean that it's not something that you shouldn't practice. One of the things that we also highly recommend is when setting up trainings for staff, to do trainings on these topics, like how do people really engage with this? How do they apply it in the workplace? And it's really important that the application is not just, again, I think the empathy, humility, and vulnerability comes much more natural with the patient services, especially empathy. And it comes much more naturally with the community you serve, which makes sense because that's the drive for what you're there, why you're working there. But you really need to also think about how am I applying this to just the day to day on how I work with my coworkers, how I respect their time, their needs, and how they then do that for me as well. So empathy simply means just being there with someone. I don't know if you all know Brene Brown. She's also a pretty famous social worker, and she has this really great video of like empathy versus sympathy. And I know one of my team members is on here, and she could probably tell you I hate the word sympathy and I love the word empathy. And part of the reason is when you have empathy for someone, it doesn't mean that you necessarily understand everything that they're going through. It doesn't mean that you have gone through the same thing, but you're just there with them. You don't have to solve a problem. You don't have to do any of that. But listening and supporting is very, very, very powerful. And part of that is just ensuring that you're meeting what, you said you would do in the health center, that you are being respectful to your fellow coworkers, and I think all of this again is reflected so beautifully in how you serve patients. But, when we feel overwhelmed and things like that, it's very easy sometimes to sort of forget then how are we applying that within the organization and to our fellow coworkers. Now, on the flip side, and why I say I don't like the word sympathy is because it's much more of a dismissal of people. And in that video with Brene Brown, and it's a little animation video, and you can find it as well. It's just sympathy versus empathy. It's more of the concept of like, oh yeah, no, that really sucks, but you know what? At least it's not as bad as this, or at least it's not as bad as that. And I say that all the time. We all do that. But the reason that's important that we think about not doing that is because in many ways it dismisses the difficulty of what people are facing. And if we really want to be respectful coworkers, if we really want to have as best of possible an organization that really values well-being and wellness of the workforce, then we need to not dismiss the difficulty as well. Honoring that, honoring those feelings, I think is really important. And simply even stating like, this does suck without saying, but, it isn't as bad as this, but it isn't, this other thing. Just sort of stopping there. And I I I work with a lot of clinical social workers and stuff. And one thing a lot of my friends are clinical social workers, not working with them. And one of my friends, what I love that she says all the time, she's just like, yeah, it just sucks. And I have brought that into a lot of my presentations where I'm like, nobody wants to work in a place that sucks. So how can you make it better? And it's really being very, very intentional on how you approach the workplace, the way that you present yourself, the way that you bring forward your communication, all of that with your fellow coworkers. Another one is empathy and humility. All of those are just really critically important. They're difficult to gain, but very, very important to do. And I just realized like time has just been flying by. So I am going to skip these other Mentimeters to try to get through the other slides, but you will have these slides with you, and I want you to think about these questions. So for example, this one, like, what is something that you need from your organization to help you feel more connected to your mission? Ask yourself that question and have this conversation with your supervisor. Like, how are you really connecting to the mission? But it's also not something that you magically can do if the organization is not supporting that. So have these conversations with your supervisors. What does that really mean to you? So, what can we do with the mission? Include just those moments in staff meetings, continuously communicate, do coffee breaks or book clubs. We did a book club for a little bit at ACU of just how do people connect and how do they communicate? And sharing patient stories is actually something that is really, really helpful and really, really important. And then I've said this a lot, but it's really important for leadership to reflect the organization's values and vice versa, just in the day-to-day actions. All of you, this is not just one side, all of you are engaging in this to move forward the values and the mission and the vision of your organization. And communication, like, I cannot say this enough. Communicate, communicate, communicate. This is also a skill. So train your staff on how to better communicate. Like everything, it's something that we learn as we go along. Okay, so I really wanted to get to this piece on professionalism. And again, I'm going to skip the Mentimeter slides, but think about these. Think about these questions, like, how are you modeling this at work? And what does that really mean to you? So I just wanted to give like a very high level overview of how are you showing up in healthcare. And again, not that in other fields this isn't important, but healthcare is so carefully structured, when it comes to timing, when it comes to how you work as a team, how are you cohesive, that when you kind of, if you don't have someone sort of contributing in the same way as everybody else, things can fall apart very easily. And what that does not only impacts the organization and the workforce, but then ultimately, how are you serving your patients? How are you serving your community? Which that really should be the key of what all of you are doing. So it's important to understand your organizational norms. How are you contributing and advancing them? A team-based environment, I really, again, going back to those other pieces, you're working in a team-based environment. Even if your organization doesn't have as much team-based care, you cannot do healthcare without that. So you have to have that empathy, that respect for your fellow coworkers. Punctuality, ensuring that you deliver high quality care. I've already said this, the empathy, the compassion. One part too that I think is really important is taking accountability for your actions. And that's really hard, especially if you're working in an organization where you feel like, if I take accountability, am I going to be fired? Am I going to be reprimanded? So I really recommend for those who are in leadership positions, supervisor positions, that when people step forward and take accountability, of taking it more as a learning opportunity on how can people really advance and get better in their role. But accountability should be across the board for everyone. Nobody is perfect, and nor should we be. And this is how we learn. But that accountability also means, how are you talking to your staff? How are you working with them? Are you on time? How are you serving your patients? All of that. Really adhere to those high ethical standards. Positive and effective communication, and we'll get to those slides in a moment. Really important to have skill development. Again, as you keep working, healthcare is changing really, really rapidly. So I would recommend for both people who are in leadership positions of being able to offer this to their staff, so people really understand, what does this mean to work in this type of environment, and the respect that we have for our staff. But then vice versa, for those who are in positions where you may not be in a management position, of being able to speak up and ask, like, hey, I really feel I have a gap here. How can I maybe do some professional development? And finally, embracing that positivity. But I do want to have a caveat of it not being toxic positivity. I think toxic positivity is really important, or really similar to that sympathy idea we're going to avoid talking about the difficulty, and we're just going to kind of sugarcoat everything, or put a silver lining on it. You don't want to do that. What you're doing is hard, and it's okay to acknowledge that. And it's really important to have those conversations, or at least give people the space to do that. But all of that comes in with ensuring that everyone is effectively playing the role that they were hired to do. Okay, so moving on to communication, same thing here. I think I get so excited when I talk about this stuff that I got really caught up in the earlier slides. But again, think about, how are you communicating with your coworkers? What does that mean? And ensure that you always approach it with a sense of respect and empathy, and understanding what is your role and how can you best meet those requirements, your qualifications, to ensure that you're working in a very cohesive place, and also ensure that you're supporting the patients that you're serving and the community. So why is it important? You're really reducing conflicts, you're enhancing those interpersonal relationships. We spend most of our lives at work. Interpersonal relationships is normal. We should talk to people. We should engage with people because most of our lives are there. You don't want to feel completely excluded either. Now, those boundaries are different for everyone, but really, really important to really understand, like, how do I engage with my fellow coworkers? It increases workforce productivity, employee engagement, job satisfaction. All of this I really talked about in a lot of the other slides, but I also want to say it helps to uncover a lot of the talents that people have. And as good supervisors, identifying that is critical, but that's why also, just as yourself, as a worker, identifying what are those places where you can really thrive as a leader is really critically important. So these slides were created by my amazing coworker, Sydney Axelrod. So I don't know if I'm going to do justice to the way that she presents on this, but really it's just open communication fosters trust, while poor communication, all it does is contribute to burnout and turnover. Sometimes we get frustrated. There's a lot that can happen, especially in these high pressure environments. So the more that you can practice these skills, and again, just sort of continue to think at baseline, how am I respecting my fellow colleagues? And how is the way that I'm showing up at work ensuring that we're able to provide our patients the best services possible? Because again, remember, these are individuals who may not have access to healthcare in other places. So you really want to look at skill building, codifying systems, channels, organizational norms. This is just really like, how are we communicating, and do we know who to go to when we're trying to reach someone? So it's really important, if I have a question, who is the person that I can go to help me answer that question? So those communication channels should really be open, and people should have an understanding of how they work, because when they break down, then the cohesiveness in the organization breaks down and the patient services break down. So really important to keep that. And just what does that really mean? When you're looking at organizational communication, you have to have the leadership buy-in, the information pathways. That's what I was talking. Do you know who to go to when and how? What are the tools and modalities that you may be using? So for example, at ACU, we use Slack to communicate with each other, but everybody has a different way of communicating. So really understanding what works for different people is really critically important, not just as a supervisor, but as a fellow colleague. And then what are your organizational norms? And essentially that's saying, what are the values of the organization? Because that should drive how you're showing up professionally, how you're serving your community, just everything that you are doing. And I really, really want to underscore that piece, that the goal of this is to continue to provide healthcare for those who may not have it otherwise. And you are playing a critical and important role in this. So what are just some communication tips? Just clear, concise, polite, respectful. Sorry. I didn't know if somebody had a question, but I want to highlight again that polite and respectful piece. Oh, So it's really, really important to have that polite and respectful piece. It really, really is. And I think, because everything can be very chaotic, conflict can happen very easily. So really approach things as respectful as possible. Kind of simple, like how you want to be treated. That's how you should treat others. Make sure it's also in the appropriate form and format. I remember one of my previous jobs, I had an intern that was working with me, and in the middle of a meeting, and this was with the Department of Defense and all that, she just called me out, and not proper format, and I appreciate it, and then we had a conversation, but making sure that when you are talking to people, you're doing it in a respectful manner, but you're also doing it in the proper format. So for example, if you have some frustration with someone, pull them aside. Don't do that in front of the patient. Don't do that in front of the people that are coming into the health center. And then this slide, very similar to the other ones, it's just your words and action, they matter. They matter. And you can always tell when a team is very cohesive that the services that they're providing to the patients tend to just be a lot smoother. So, what you say and what you do matters, and how you say it and the actions you take are critical. And part of those actions is ensuring that you're showing up and meeting the demands of your work and meeting why you were hired to do that. And then finally, I just have a few more slides. Just team communication, really important. All team members should really be trained on communication basis. So this is something we always recommend for health centers, that people are able to do these type of skill building activities to better perform and have better cohesion across the board. Also, assume good intent. I think this goes back, and I know we just have a minute, but I just want to wrap up with this, of going back to that empathy piece of, sometimes things are really difficult. You may not know what is going on in someone's lives, both professionally or personally. So try to assume good intent, because then you can approach it in a very respectful manner. But at the end of the day, it is all about, how do you work together? How do you communicate? And then how are you meeting the demands of your job for serving the population? And this is the final slide I have. And really what it is doing, it's supporting your workforce well-being. It's increasing your retention. It's really, efficient workflows, and communication is part of that. And then finally, it's just that alignment with meeting your organizational goals. So at the end of the day, this is exactly what you're doing. You're focusing on, how do we continue this movement? How do we continue what it means to be part of this history and of this health center program? So I know we're a minute past. I'm happy to stay on and answer any questions. Like I said, I got really into like the earlier slides, but I think I just really wanted to emphasize for all of you what it really means to do the work that you're doing, and why it's so important, to make sure that you are meeting the demands of the job while still being, looking at well-being and aspects of that. So Ashley, I'm sorry that I took a little bit longer. I know I got very wrapped up in everything.
No, thank you. I think that was a great overview. I'm waiting to see if there's any questions. I've been keeping an eye on the chat for you.
Yeah, and I think I can see that. Oh, there we go. The only one I see is someone said they lost their connection. And of course, you have our contacts. So, if you have any questions after, I'm happy to answer them at any point. This is, again, just another slide with our contact information.
And we'll make sure everyone gets a copy of the slides. The one question I love to ask that, if we don't have any coming through, that I'll ask you, Michelle, I know we talk, it supports many different aspects of the workforce for people to really recognize their role being tied to the mission and supporting the mission and being an integral cog in that. For positions that are maybe back of the house, that they don't have maybe that patient interaction where they really get to feel that every day, maybe they're stuck working on report. How can managers and individuals really help people in those roles feel like part of that recognize
Absolutely.
that piece?
Absolutely. And I think that that is such a great question. One thing that I recommend, especially when you're onboarding someone and bringing someone new, but I think across the organization, of, having opportunities for everybody in your workforce to go out into the community. When you have meetings, being able to share patient stories, like what are the wins that you have? Because with this being hard work, you may not get as many wins, but you should really celebrate that. And I think for people in management and leadership, it's really showing those individuals how, while you may not be at the front of the house, you may not be doing the direct patient services, how your role actually is directly impacting those patients. So I think about, someone who may be doing coding or something like that. That is critical because it's ensuring that people are able to have their services covered. It's also critical for the organization because it's ensuring that they're able, to stay functioning by being able to get in the money that they need to function. So I think it's really important to just have those regular conversations with your staff where they really understand how their role impacts the broader scope of what it means to work at a health center. And this is why those pieces of really being able to meet what, your job requirements and stuff like that, and vice versa for leadership to be able to support people through skill development, well-being, and all of that is really, really critical because it creates that connection. But I think just those conversations of literally showing people like, this is the impact that you're making, and here's what we're hearing from patients. And while you were not there in the exam room, what you did created this positive outcome. Awesome. I see the heart. So thank you. I can't see myself on camera, so I don't know if you saw me make a heart, but I was doing that.
Okay, well, Michelle, I so appreciate that. I think that's a great comment and good for managers and individuals to just think about how they can really connect those dots. So we so appreciate you being with us this morning. It was a great presentation. I'll ensure everyone gets the slides, and that'll include your contact information and where they can, find other resources from the Star 2 Center. So thank you so
Absolutely.
much.
Yeah, thank you so much. And thank you, everyone. You all were wonderful. Bye, everybody.